Okay, so do you want to record me or is it recording me
It's
now?
recorded now.
Okay, so the first word you have checked here is ambivalent. That means my feelings are ambivalent to you. Something like, I think I love you, but I don't know, so I'm ambivalent. I don't know. I'm uncertain. Okay?
An example of a sentence, please.
I'm ambivalent with my feelings towards you.
You can just read it. It's okay.
Oh, okay, yeah.
Yeah.
Okay, and then let's see. The next one is concise, CONCISE, brief, to the point. I'm giving you a concise sentence right now, to the point. Contraindication, a reason something is not advisable or should not be done. So like a contraindication would be if you were taking medication and you were allergic to it, and it would say allergic to sulfa. So sulfa is a contraindication for you taking that medication. Okay?
Yes.
The next one is deteriorating. So that's a little bit harder to say for me, deteriorating. So worsening, your health is deteriorating. Minute by minute, your breathing is getting slower, so your health is deteriorating. So an example is like a dental hygienist explains that your condition of the patient's gum is deteriorating. Let's see, exacerbate. Exacerbate, to make worse or severe. An example, the physical therapist recognizes that too much exercise would exacerbate the patient's breathing difficulties. So same thing I would say, anytime you have like a disease process going on, something could exacerbate that. So if you had asthma and you went for a jog, that could exacerbate your asthma. Let's see. All right. Impending, occurring in the near future, about to happen. Your example here is the nurse manager increases the emergency room staffing in anticipation of accidents being caused by an impending snowstorm. So it's something going to happen. Somebody feels anxiety and they feel impending doom. So it's going to perceive to be happening. So it's impending. Impervious. So a lot of these words are important in nursing because we use them in sentences. And impervious, impenetrable, like not allowing things to pass through. Your example is a standard precaution requires you to use an impervious gloves when body fluids are handled. So like an example of that, when I put down a drape and I do a sterile field, the sterile field is impervious to fluids because if you laid down this drape and there was some water and it got through that drape, then it would contaminate your sterile field. So you use impervious drape. I have to use my own examples, sorry.
That's very good. Thank you.
Imply, to suggest without explicitly stating.
I understand only suggest.
Yeah, I'm really happy, but my body language is not implying that. Do you understand that?
Yes.
So it's like I'm saying
Showing.
one thing, but that's not what is implied. So the example is the look of an administrator's face implied that she wasn't happy about the results. Infer, to me, I think is almost somewhat similar. To infer is to conclude or deduce. Example, when a patient is starting to cry while receiving an injection, the nurse would infer that the patient was in pain. So you're kind of thinking about it, you're deducing, you're coming to your own conclusion, you're making a reference or inferring that that person's in pain because they're crying. So infer. Sure didn't miss one. Insidious is a very good word. We use that a lot in nursing. So gradually or not becoming apparent for a long time. Example, the physician explains that cancer probably started years ago, but had not been detected because its spread was insidious. It means like undercover, not known yet until it shows. So it's hidden. My example would be chicken pox. So you have that virus in your body, and at later times, it could pop out and be shingles. So it's like an insidious virus. It hides in your nerve endings, and it's insidious because it all of a sudden one day pops out as shingles. So it's hidden to you. Intact, in place, unharmed. The nurse observes the patient's bandage was intact. Not only do we use that word for bandages, intact could mean that the wound is intact. That means that instead of the wound separating, that means that that the wound is intact, it's closed together. I think that would be about the best example about the Band-Aid though. Like a bandage is intact, it's not ripped, it's not torn, it's, the tape is on the bandage and it's intact, it looks perfect, it's what it should be. If the bandage was hanging off or something like that, then it's not intact. These are good words that you're asking. Libel, or some people say label or libel, and it's changing rapidly and often. So the example, because the child's temperature was so libel, or label, they call it if it's French maybe, the nurse instructs the unlicensed the CNA to check the temperature frequently. So it's like ever changing. It's not standard, it's not straight across, it could be variable. So maybe to me, libel means not static, it's forever changing. Laceration, cut or tear. An example, after an accident, the paramedic explained the patient's lacerations. So lacerations are cuts. Let me see. Occluded. Occluded we use in quite a few different things, like example, because the patient's foot was cold and blue, the nurse reported that the patient's circulation to the foot was occluded. Occluded also could mean like you have an IV running and you go to do an IV push and it won't go in there. So they know there's an occlusion there. So that IV would be occluded if the fluid's not going in the vein. So obstructed is more, to me, what occluded means. Ongoing, continuous. Like our conversations, anytime you want, are going to be ongoing. So
Great.
Continuous. Example, the nurse instructed the patient that the treatment would be ongoing throughout the patient's entire hospital stay. Pathology. Pathology is the process, the cause, the effect of the disease, the abnormality. The example, the doctor called to request the pathology report for her patient. So a doctor goes in and takes a biopsy, and he's going to have to look at the pathology of that to determine what kind of cancer or what kind of disease process is going on. So they look at the pathology of the tissue or whatever they're excising or whatever they're taking out. They're looking at the tissue, and the broader term is the whole process, the cause, the pathology. So if you have, say, a lung issue, why are you having the lung issue? What is the pathology behind the disease? So they're looking at, that's more of a broader term, pathology. Potent, producing a strong effect. For example, the potent medication immediately relieve the patient's pain. So you could take Tylenol, it's okay. But you could take morphine, that's more potent or strong.
Stronger.
Strong. Rationale, this is a very good word that we use this one all the time. The underlying reason. Example, to make sure the patient will follow the diet instructions, the medical assistant explains the rationale behind the low sodium diet. And I always tell the students, if you don't know the rationale, if you don't know why, then the question's not important to you. So when you read nursing questions, we always give you a rationale of why that answer is really important, why you should have chosen that answer, because some of the other answers might be good as well, but the rationale behind each one of them is important. Why is it happening? How is it happening? So the rationale is more of a detailed explanation of why the question is right. So that's rationale. Reoccur, to occur again. Example, to make sure that the tooth cavity does not reoccur, the dental hygienist instructs the patient to use toothpaste with fluoride regularly. So to keep happening. We don't want this to recur again. Let's see. Retain, to hold or keep. Example, the nurse administers a medication to prevent the patient from retaining excess body fluid, which means, which might cause swelling. So example in this one, to me, retain, to hold or keep. You understand what anemia, not anemia, edema. So edema of the legs.
That's a
Swelling. So a lot of people that eat too much sodium are going to retain fluid. So retain, hold on to, keep, and that's what we would use that one for a lot, is retaining fluids. Serene. Serene is calm or tranquil, and the example is the massage therapist played serene music during the massage session. So very calm and tranquil. What we are very now, right now, we're very serene in here. I like to keep the lighting low, have natural lighting. We're very serene. Symmetrical or symmetric. That's another great word because we use that. And the thing is that you can understand all the medical things you want, but these words in the middle of a sentence, if you don't get that meaning, that's the problem. So you're very good for coming in for this. Symmetric or symmetrical. Being equal, the same size, shape, a relative position. For example, the paramedic observed that the movement in both sides of the patient's chest was symmetrical after the accident. Here's why that's important. If it's not symmetrical, if the question says something like, after observing the chest, you see that there's asymmetrical movements. So that means one side of the chest is rising and the other side's not. So symmetrical means we're going at the same time. But when you put an A in front of it, asymmetrical, they're not the same. They're different. So one is rising, the other one's not. So think about the prefixes and the subs, that would go with that would be asymmetrical. Symptom, an indication of a problem. For example, the nurse recognized that the patient's weakness was a symptom of bleeding after surgery. So to me, an example of this, if you want me to add my examples, that so the patient had surgery and now you see their blood pressure is dropping, drop, drop, drop. That is a symptom of the blood loss. Okay, so
Yes.
you're looking at all the symptoms and then you're inferring that's what's causing the problem.
Okay.
Use two words.
Yeah.
Ha! Another one, and I've had students ask me this question on tests. So if you get to a point, and you know, don't quote me, but if you get to a test question and you're in lecture, and if you really don't understand a word, you can ask the instructor, and she has a right to answer it or not answer it. Sometimes it might give away the question and she says, I can't answer that for you, but a lot of our instructors would answer that for you. Ambiguous means being or seeming to be everywhere at once. I don't know if I would explain it that way, but the patient noticed the ambiguous no smoking sign at the clinic. So I would think of ambiguous meaning everywhere and nowhere. There's so much everywhere that you don't even see them because they're all over the place. But ambiguous here means being or seeming to be everywhere at once. Sometimes when you put too many signs around, people don't see them because they just ignore them because they're always there. So that means that's what that kind of means. All right. Yay.